Hello everybody. Now in this video, actually is a continuity to the previous one. In the previous video, we just defined what is the disease and what is the components of the disease. Okay, this one, we just talk about a part of disease which most of the time is not seen, is hidden, most of the time is not acknowledged because it's very difficult to really localize. Now, again, in my past, just trying to help people fighting disease, fighting their problem, right? So I never had a big deal results. You know, just looking at the people taking same drugs and the problems there. Feel better while take the drugs. If you don't take the drugs, so just right back the same stage. Like as I say that you have a cholesterol, right? Is take the cholesterol pills and you do better. But if you don't take it, jump again up. Okay. Now we're having high blood pressure, right? So just taking pills, the blood pressure goes down, or you don't take, goes right up. Or simple, having some stomach issue, some gastritis, taking pills, you don't feel the acidity. Once you don't take, the acidity is right back. See, so that really drives me crazy. So you know, and I just felt that I am helpful. I'm not useful. I was not helpful to patients, to people, because I couldn't help them. So you see, and I just start looking to chase it, the why, the answer of why the problem is there, why you make it better with a couple of drugs, if you don't take them, you go right back. So then I just decide, and I define there is some third part of any disease, which is the first one was symptoms, then was disease itself, and the third part is a cause of this disease. You see? Now, to chase the cause is very complicated because you have to know more than particular organ or more than that particular system. More, you know, you have to really spread out and look around the organ itself. See, so I just try to really research on any patients in any disease to look for why, and I finally localize. In many situations, I localize. An example, let's take from up down. Now I just people having headache or having sometimes tremendous migraine. Now, you know, once you have migraine, you take some pills. If suffer for 3, 4, 5 days, then you feel better. They feel okay, and then after depend how often, 2 or 3 weeks, or after 3 weeks, 4 weeks, or 1 month, a month and a half, the migraine come back. Or you have headache. Some people have headache every day. Wake up in the morning with headaches. Now, headache was the symptoms. You know, was a pain. So the problem was, what was the cause of this headache? Because taking pills, the headache goes away, right? Now, the headache caused a lot of other problems, caused nausea, caused insufficiency, problem of focusing, of concentrating. So just see, but what is the cause? So I was searching, and I realized, and I found, of course, there are some other causes, but I just localized the most often. Neck problem. Sometimes very simple, a tension in the head muscles, like the muscle that dress up the bones. They get tense, they get tight, and squeezes the bones and squeeze those ligaments between the interosseous ligaments between the head bones. So those are aching. So all those they cause inflammation, right? So the inflammation causes pain. So the pain can last. So you take some pills, relaxing those muscles. So until this tense up, and the game it goes back in the same place, or it's just. Very classical things is with the blood pressure. having high blood pressure. Blood pressure gives the symptoms as a pain, as a pressure in the chest. It is danger. It can cause a stroke sometimes, you know. I was just searching. Yes, was caused by classical, the kidneys issues, right? Because when the blood goes through those kidneys in order to unload the toxins, over there was those tubes were narrow and the heart needed to push harder. But taking pills didn't do any better. So I tried to treat to improve this one. So I tried to remove the tension in the lower back, which was causing tension in the kidney. And you know what I discovered? That's actually often, very often, the blood pressure, which is caused by for the heart, which make the heart to push harder to move the blood, is also in the head. So the blood vessels in the brain get narrow. So if the blood doesn't go through to certain places in the brain, so you know, the brain just call the heart, listen, press harder because the blood doesn't go here. So the heart press harder, which it's good in a way because this way move the blood in the places, but it's a bad in other ways because it can, any blood vessel can burst. It bursts in the brain, so it causes a stroke. So that's why very often there are people with a high blood pressure causes stroke. It's not only because the blood pressure. The main cause actually is that blood vessels are very thin and or they are obstructed. There is a compress for some reason. So it's a whole chain. It's hard to go in the details. We'll do sometimes. I'm going to make a video just on blood pressure, which takes probably a long time. So now just to give an example that's, you know, that any disease has their causes. So I established this concept, cause-effect relationship, or relation between cause and effect. So, any disease is an effect, which that effect, which is the disease, it has its own cause. So they are related. It's not possible disease without having its own cause. Most of the time, the cause are not known. Sometimes just blame some small, immediate, as we call, causes, but they are not really. See, like you have a gastritis, if you eat certain food, it creates acidity. That is not a cause, because you already have gastritis. So gastritis is a disease. Of course, when it's the disease over there and the organ is very sensitive, a lot of things would bother it. So, but the cause is very something else. In the future, we're going to take organs one by one and we'll talk about the cause of each the disease that affect certain organ. Would be nice. And I also urge you guys, just ask questions. You know, very simple. I can answer the question. I can develop a video based on the subject that you guys suggested. So you know, it will be much easier for me to be helpful to you guys, to be useful to you guys, and you know, make sense. It's a wonderful thing to help and to feel useful and helpful. But it would be even easier for me if you guys just suggest that. But anyway, I will just go subject. Probably I try to put here like twice a week a subject. Which I get to video, and I'll offer you an information. Again, all the information that I offer here, they are based on my finding within my office and my practice during those 45 years or more, working with the patients, helping people to really restore their health and remove their disease. And I just learned from the practical perspective and point of view. I learned very much about disease. But what I learned much more, because you know, conventionally we all know about disease, we all know about the symptoms, but almost is not known the cause of various disease. Actually, this is the key. That is the dedication for this channel that I going to are going to use this platform to really inform everybody. Hopefully some medical practitioner, some doctor will just listen, so will just find some of my information and to use on their, I would say, in their practice, in their office. Yeah, even ask questions. So actually, that's about relation between cause-effect of cause-effect relationship. That is the concept that I use with helping people to restore their health, maybe at least 95% of the time, or even more. Yeah. So it's very wonderful things. It's very good to do. Feel that like it's completing, because you feel the symptoms, you know about the disease, which is there where the symptoms come from, but that complete the scene. If you find the cause, the whole thing is there, so you can help much more any patient. You can help much more yourself in order if you suffer of any kind of disease. You see, as I said before, once you know the cause, when you localize the cause, when you address the cause, the helping the fight against any disease, it's much lighter, much easier, and you can achieve much more. Okay, so we'll talk specific in the future about each particular organ, each particular system, when we relate the disease that affected and, based on the symptoms, and we just go deep to their cause. Again, I expect you guys also to ask question and to ask suggestion. So I'll be there with you guys, and I'll be pleased to help. Okay. In meanwhile, take care of your health, take care of yourself, and all the best.